Neurotransmitters. Nerve cells communicate with each other through neurotransmitters. An electrical signal travels down one nerve cell, causing it to release the neurotransmitter into a small gap between the cells called the synapse. The neurotransmitter travels across the gap, binds to a protein on the receiving cell membrane called the receptor, and causes a change in the receiving cell. The neurotransmitter and receptor are specific to each other. Neurotransmitters can either excite the receiving cell to cause a response or inhibit the receiving cell from stimulation. Alcohol and the brain. Alcohol enters the body and 20% is immediately absorbed in the stomach, while 80% is absorbed into the small intestine. The heart then pumps the absorbed alcohol throughout the whole body, including the central nervous system, which consists of the brain and spinal cord. The absorbed alcohol gets through the brain quickly, which causes feelings of lightheadedness and relaxation. Alcohol directly affects brain chemistry by altering levels of neurotransmitters or chemical messengers that controls thought process, behavior, and emotion. Alcohol interferes with communication between nerve cells and other cells, affecting both the excitatory and inhibitory neurotransmitters. One example of an excitatory neurotransmitter is glutamate, which would normally increase brain activity and energy levels. Alcohol suppresses the release of glutamate, resulting in a slowdown along the brain's highways. One example of an inhibitory neurotransmitter is GABA, which reduces energy levels and calms everything down. Alcohol increases GABA production in the brain, which results in sedation. This suppression of the excitatory neurotransmitter glutamate and the increase of the inhibitory neurotransmitter GABA slows everything down, affecting your thoughts, speech, and movement. The cerebral cortex. In this region, where thought processing and consciousness are centered, alcohol depresses the behavioral inhibitory centers, making the person less inhibited. It slows down the processing of information from the eyes, ears, mouth, and other senses, and it inhibits the thought process, making it difficult to think clearly. The frontal lobes. The brain's frontal lobes are important for planning, forming ideas, making decisions, and using self control. When alcohol affects the frontal lobes of the brain, a person may find it hard to control his or her emotions and urges. The person may act without thinking or may even become violent. The cerebellum. The cerebellum is important for coordination, thought, and awareness. A person may have trouble with these skills when alcohol enters the cerebellum. After drinking alcohol, a person's hands may be so shaky that they can't touch or grab things normally, and they may lose their balance and fall. The hippocampus. This is the area where memories are made. When alcohol reaches this region, a person may have trouble remembering something he or she just learned, such as a name or a phone number. This can happen after just one or two drinks. Drinking a lot of alcohol quickly can cause a blackout, not being able to remember entire events, such as what he or she did last night. If alcohol damages this region, a person may find it hard to learn and hold on to knowledge. The hypothalamus. Alcohol upsets the work of the hypothalamus. After a person drinks alcohol, blood pressure, hunger, thirst, and the urge to urinate increase while body temperature and heart rate decrease. The medulla. This area of the brain handles such automatic functions as breathing, consciousness, and body temperature. By acting on the medulla, alcohol induces sleepiness. It can also slow breathing and lower body temperature, which can be life-threatening. Long-term effects of alcohol. Binge drinking and continued alcohol use in large amounts are associated with many health problems, including the following. Drugs and the brain. The brain communicates through the networks of neurons, passing messages back and forth among the different structures within the brain, spinal cord, and the nerves in the rest of the body. To send a message, a neuron releases a neurotransmitter in the synapse to be received by another neuron. This neurotransmitter crosses the synapse and then links to the receptor or protein of the receiving cell. Drugs affect the brain by interfering the communication between the neurons. They tap into the brain's communication system and tamper with the way nerves normally send, receive, and process information. Drugs target the brain's reward system by flooding it with dopamine. Dopamine is a neurotransmitter in the brain that controls movement, emotion, motivation, and feelings of pleasure. This is the system responsible for rewarding. However, when overstimulating with drugs, it creates extreme happiness or relaxation, which drives the user to repeat the use of the drug. Long-term effects of drugs. MDMA and the brain. MDMA or ecstasy is a man-made drug that produces energizing effects similar to the stimulant class amphetamines as well as the psychedelic effects similar to the hallucinogen mescaline. MDMA affects the brain by increasing the activity of at least three neurotransmitters, the serotonin, dopamine, and the norepinephrine. MDMA causes these neurotransmitters to be released from the neurons, increasing the neurotransmitter activity. It causes greater serotonin release and somewhat lesser dopamine release. Serotonin is a neurotransmitter that helps regulate mood, pain, sleep, appetite, and other behaviors. It causes the release of hormones oxytocin and vasopressin, which plays an important role in social experiences. Having too much release of serotonin by MDMA causes mood elevating effects, but because of this large release, it causes the brain to have a low level amount of this neurotransmitter, causing negative behavioral effects such as confusion, depression, sleep problems, drug craving, and anxiety for several days after taking MDMA. Long term effects of MDMA or ecstasy.